Let's start at the beginning. What is at the root of the sanitation crisis in Zimbabwe?
You know, the interesting thing is that in the late 80s and 90s, 84% of Zimbabweans had access to clean and potable water. But Zimbabwe's water and sanitation system has been crumbling, and it has not been maintained. So what we're seeing is the burst sewage pipes and the sewage seeping into broken pipes and into the water system. So the tap water that does come out is actually contaminated. That's if it comes out at all, because like you said, the people in the residents of Harare, especially the high-density suburbs, hardly get any tap water at all.
That's very worrying. I just want to go back to, we say that, 4,200 people were killed, in 2008. But how many people were affected wider than that, if you have an idea? And then the threat that is faced right now, how immediate is that threat?
Well, it was hundreds of thousands of people were actually affected by the cholera outbreak in 2008. But the government of Zimbabwe has been in denial and actually denied the true extent of that cholera outbreak and the causes, which was this crumbling water and sanitation system. Right now, we've seen minor typhoid outbreaks where hundreds of people have died and thousands more have fallen ill from typhoid. But there's also the threat of other waterborne diseases, especially to children who are under the age of 5. And the biggest problem is not only the fact that the tap water is contaminated, the boreholes, which people also turn to, and the wells, at least 33% of those are also contaminated. And finally, the toilets are blocked because there's no running water. So people are forced to defecate outside. So all that combined just simply contaminates the entire water system in Harare.
You mentioned that the government is in denial and that you as human rights, you've warned them about what could be in store. What has their reaction been to this so far?
Well, their reaction has been to say that more resources are now going to be allocated to the water system. We understand that the Chinese government has donated millions of US dollars to rehabilitating the system. But another problem that we identified when we did our research was the fact that there's been a lot of corruption and a lack of transparency in how resources are allocated within the local municipality in Harare. And there's also been a lot of political infighting. So it's been a big problem where the resources have been there, but they just haven't been allocated properly, and no one has been sure as to where the resources are actually going. There has been complaints by local NGOs that some of the local councillors have inflated salaries. So the money is not going where it's needed.
Yeah. Are we seeing an increase in cases of cholera now already? And do you have sort of an idea of what sort of time frame we're looking at until this supposed explosion could happen?
Well, the rainy season has now begun. And quite often what we find is that's when you get the most waterborne diseases and the highest rate of waterborne diseases. So this situation is exacerbated by the fact that the rainy season is coming, that the sewerage outside, that's seeping outside people's homes. People can't drink the tap water, the borehole water, the well water, the fact that they're defecating outside, and the refuse is also not being collected. So this is all just coming together, and it's a very bad combination, and we don't know when there'll be a crisis. But what we're saying is, if things are not addressed immediately, we could see yet another big crisis like the cholera outbreak in 2008.
And if there had to be an outbreak right now, do you think that the government in Zimbabwe and the medical services would be prepared for, or properly prepared for such an outbreak?
Well, because there's been a lot of denial, that's the problem, and we don't think that they're prepared in the immediate term. Yes, this money is there for the long-term rehabilitation of the system, but what we've been recommending is that there should be alternative toilet facilities for the people in Harare's high-density suburbs, which they can use instead of defecating outside. There should also be alternate arrangements in terms of boreholes, and the government should allocate some resources towards buying chemicals to actually cure the water, which is contaminated in the wells and in the boreholes. So that would actually, I think, assist in trying to distract from this potential crisis, so to speak.
What would the advice then be now to the citizens of Harare? What sort of precautions should they be taking?
What we're saying is, please don't drink the tap water, and please check if the boreholes are actually cured and actually have chemical tablets. We've been encouraging people to boil their water, because that quite often does help. Boil all drinking water and all water that is used to wash your dishes, etc. But we're also calling on the government to go on its own outreach campaign, and the Ministry of Health as well.
Well, we hope that the crisis of 2008 is not repeated, and one death is already too many. But thank you very much for joining us this morning. That's Southern Africa's Director of Human Rights Watch, Tiseke Kasambala. Thank you once again for joining us this morning.